What's up, everyone? Welcome back. It's Wednesday. I know we missed one, but I am here. I'm back. The team is back, and we are ready to rock. Today's gonna be a lot of fun. How's it going, everyone? I see a lot of familiar faces, new course, old courses. Welcome back to a great lecture. Today's gonna be a lot of fun because one, we're covering antibiotics, which I haven't done before. And not only are we covering antibiotics, then we've got trivia right after. So those that want to stick around for trivia, I'm going to let you know right now, download Kahoot. Download Kahoot. It's an app. Download Kahoot, and you'll be able to just create a login real quick, and then you'll be able to scan a barcode or enter a pin, and you'll be able to compete for prizes. Today's lecture is going to be on antibiotics. I'm going to get into that real quick. And then after that, we're going to do the trivia, which is to get our neurons firing. You're going to see a lot of associations happening real quick. So so real quick, let's get some announcements out of the way. So again, financial assistance letter, ask. I know times are tough, and I understand groceries going up, gas is going up, little things like milk are really, really expensive. So ask for financial assistance. You'll be surprised how many people are still willing to help you become a nurse. Tutoring, our tutoring is still on special. I am sold out. So those of you that already have me as a tutor can continue with me. Those that don't, unfortunately, I am sold out. Free resources. Look, I've put up more podcasts. We're putting up new YouTube videos. We're posting more. We've got a great social media team now that's going to be posting a lot of cool stuff. So keep a lookout for it and just make sure that you're following us on everything. Don't just follow it, subscribe to it. So that way, when I do put something up, whether you're just a student using all the free resources or you're actually a student that was in old courses or in the current course, make sure that you subscribe, because sometimes I just throw up a podcast and you're like, oh, whoa, Dr. Z forgot to tell us about this. So again, make sure that you're following us on all the free resources. There's nothing better than free. So get your free education on. Self-paced course. Our next course is not going to start till October 1st. October 1st. We haven't finalized all the dates, but it does start October 1st. In the meantime, get started on the self-paced course. Those that are in the course or those that have taken the on-demand self-paced course, put your honest feedback in the chat. Like, if you like it, if you don't like it, just be honest is all I ask. Like, it's not really worth it, or hey, I love it. Whatever you feel, just honesty is all we care about. That is all our announcements for the most part. Then something really bothersome happened, and this really threw me off. We found a bunch of people that were sharing logins and that were getting pirated NCLEX High Yield videos. A bunch. This is the letter that they are going to receive. This is coming directly from my lawyers at NCLEX High Yield. They told us straightforward that they found people buying it on Facebook, people buying it on Etsy, people sharing it. They were able to track Cash App, Zelle, WhatsApp groups, Facebook groups. They were able to find so many people, and they were able to track all their emails. If you receive this email, I've been told you should find a lawyer. If you get this email, you should find your own representation, because they're coming after you hard. So if you know anybody that's doing it or you were guilty of it, then try to at least acknowledge it and come to some sort of an agreement, like, hey, we're not going to do it anymore, and they'll be forgiving. But this is happening as we speak right now. So just that letter is going out to everyone, and you can take a screenshot of this if you want, so you can read and share it. So just, it's sad to me that people, because they're getting reported, not only are they getting sued, they're getting reported to all 50 states and Canada, the boards. And right now, ethics is huge because of all the schools that are being run unethically. So please, just don't do it. Don't do it. It's not worth your livelihood and your future. So I would just screenshot that. If you know anybody that's doing it or a group that does it, just screenshot it and share it on there. Like, hey, look, I would stop doing this because they are coming after everyone. So sorry about the bad news there. Not to be a Debbie Downer. Flash sale is still going on, $2.99 if you want to do the on demand. So again, I know all my loyalty. I know I got a lot of people that are loyal out there to NCLEX High Yield. All the high yielders are definitely loyal. And then we just been getting, like, I'm not doing testimonials anymore because I don't want to take up too much time in the beginning. But these are messages that I'm getting in the last, like, look, September 2nd, Monday, it's just Wednesday. These other ones came in today. 85 and out, 85 and out, 85 and out. If you're doing something right, and I see all like my students that are like keeping their camera on, they're participating, they're answering questions, you're in the right place. You're in the right place. And if you're still struggling, think about all the think about all the money that you're losing every time that you're spending another year, even 45 days. So just make an investment. It doesn't have to be with us. Just make an investment. All right. Let's get started on Pharm. So the cool thing about Pharm in general, there's only 5 ways I can ask Pharm. I write questions. I know exactly the 5 ways that I'm going to ask you a Pharm question. And that, it should give you some ease. It should give you a peace of mind. Like, hey, look, if I see a drug, there's really only 5 ways that they can ask me this question. The first one is identification. Identify it. What type of a drug is this and what is it used for? The second thing is, what are the side effects of this drug? The third one is contraindications. If I take this drug, what can I not take or what should I not take? Dosages, maybe, like there are some ones in EKG, like adenosine, atropine. There are some that we do administration and we do dosages. But for the most part, dosages are a little ambiguous unless there's a strict protocol. So it's like, well, how much atorvastatin should I start them on? Well, it depends. How bad was their cholesterol levels? How are their liver function tests? So on and so forth. So dosages aren't really super high yield. The ones that are, know them. And the other one, the last way to ask it is just education. What am I going to teach you about when it comes to medication? What am I going to educate you if I discharge you? What am I going to educate you about this medication when you consume it? So there's only 5 ways. Those of you that have the quick tip book, it's in the quick tip book, which are back in stock and they're all shipped out. So I don't know if one of my students has a link to it. That'd be great because I am short staffed. So this is the only ways that I can ask a Pharm question. And if I'm asking you about Pharm, then you should know, you shouldn't memorize Pharm as an entire subject. You should look at Pharm system by system. Oh, this is a cardio drug. Oh, this is a renal drug. Oh, this is heart failure. Whatever the situation is, learn it that way so you can associate it. You can associate it with that specific disease process, pathology, that situation. So don't feel intimidated by Pharm. For the most part, Pharm is going to have a rhyme and a rhythm to the suffix or the prefix of the actual drug. For instance, our LOLs or our cyclines, as we're going to learn today, our silins, as we're going to learn today. There are ones that are not as straightforward. Things like mental health, like SSRIs, they don't have a complete rhyme and rhythm to it. But again, you definitely want to make that association. For instance, in this quick tip, I talked about statins. I talked about NAFLs. So those drugs have that suffix. So know them, identify them, and now you've made that association. So now we get into antibiotics. So the different classes of antibiotics are what I want you to understand. I'm going to go with the highest yield to the lowest yield. And so when I talk about them, antibiotics are a little dry. They are a little dry, but I'm going to highlight what you should know, period. And then we are going to do practice questions before we get into trivia today. So we're going to have a lot of great information. Those of you that joined today, you're in for a treat. You're really in for a treat. So the first class of drug, arguably the most popular drug that you're going to come across. Now, let me preface this this lecture by saying that antibiotics are probably going to be the drug that you're going to see the most. So think about that. I talk about statins, I talk about beta blockers, I talk about pills, I talk about all these drugs, and I'm like, look, they're commonly prescribed. You should know them. What do you think is probably one of the most commonly prescribed drugs, period? Antibiotics. Antibiotics, right? So people are going to get sick. Kids get sick. We get sick. So knowing your antibiotics, whether you're taking them, prescribing them, or you're seeing and educating your patients on them, you should be familiar with them. And again, I'm going from the highest yield to the lowest yield. So our first one is penicillins. So penicillin G, penicillin V, amoxicillin, ampicillin. Again, they all end in cillin. So what are they going to cover? Well, they're broad spectrum. They're kind of they are our first go-to when a kid gets an ear infection, when we see a kid with strep throat. So think about where we start in pediatrics. We always start with penicillin or amoxicillin. That little, remember the pink bubble gum, the pink bubble gum flavored one that we put in the fridge, right? Everybody kind of remember that one. So that's where we start. We start with penicillin. But what we need to know, aside from the fact that it's a great broad spectrum antibiotic, is that we can develop allergic reactions. Now, when I was growing up, penicillin allergies, nut allergies, egg allergies, they weren't a thing. Okay. Nowadays, allergic reactions are huge. They're huge. So knowing that penicillins not only cause an allergic reaction, but they can cause an anaphylactic. Sorry if somebody can, whoops. Anaphylactic reaction. Let me write that. The fact that they can cause anaphylaxis means that it's life-threatening. Now, when we give a child its first dose of penicillin, any type of penicillin, right? What are we going to see? Are they going to, like, is their airway going to close up? Because that's what we're concerned about developing, right? Is their airway going to close up right away? Is that the first reaction that's going to happen? Not necessarily. What's going to happen is welds or hives or itchy or swollen throat. But the full-blown anaphylaxis is when they have it a second time, when they're exposed to it again and the body releases all this histamine and the body releases this allergic anaphylactic reaction, because that is a deadly reaction. So penicillins, again, the first line that we give as an antibiotic, and anaphylaxis. So what are we looking for? What we're looking for here is that they develop not just a rash. A rash is not too indicative of anaphylaxis, but when we have like a swollen throat, itchy throat, welds, hives, now we're concerned. It is metabolized by the kidney, so we're concerned about kidney function, which means what lab values, which you should know, are going to be part of the kidney, BUN, creatinine, right? And then a history of seizures. Now, we move on to the second most common one. And the reason why I put this as the second most common tested one, is because cephalosporins, they're also a great broad spectrum. They can cover a lot of different bugs. So things like respiratory infections, you'll see skin infections, But the problem with this is that it's got a cross reactivity with penicillin, 10% cross reactivity, which means if you're allergic to penicillins, then am I going to take a 1 in 10 chance that you're going to be okay with cephalosporin, knowing that you can have an anaphylactic reaction? Am I taking that chance? No. 10% is a lot. 1 in 10 people can die. That's a high mortality rate, in my opinion, right? 10%. So what are we going to do? We're going to educate. This is one of those questions that are great. Education. Educate your patient that, hey, oh, the patient will say maybe a further teaching, further intervention, further education type of a question. I'm not allergic to cephalosporins. I'm only allergic to penicillins. Actually, we're going to teach you that cephalosporins have cross-reactivity. So if you're anaphylactically allergic to penicillins, we do not want to give you any type of cephalosporin. So again, in general, with these two drugs, I want you to take away this. If I give you a medication, then there's a chance that you're going to get some sort of GI distress. Sometimes our stomach can't handle it. And I always say with medication, not all the time, but a good majority of the time, what's the first reaction that we're going to see? The first reaction we'll potentially see is some sort of GI distress, some nausea, vomiting, diarrhea. So GI issues. But again, nothing that I'm too concerned about. More so, we're worried about that anaphylaxis. All right, now we move on to macrolides. Macrolides, erythromycin, azithromycin, clarithromycin. The two that you're going to see a lot, you're going to see erythromycin and you're going to see azithromycin. With azithromycin, the big one that I want you to know, couple of things that I want you to know. Upper respiratory, bronchitis, azithromycin you're going to see. Azithromycin, also known as a Z-Pak. Azithromycin, you're also going to see it in sexually transmitted diseases. And we've had a surge of sexually transmitted diseases. So do you think identifying things like gonorrhea, chlamydia, syphilis is important? Well, syphilis, we got penicillin. Chlamydia, gonorrhea, we've got azithromycin. These are things that are surging. So knowing STIs, knowing the treatment for it, and now knowing this major side effects. In this one, the one that the boards are going to like to target is that QT prolongation. So just a quick little segue into EKGs. So we got our P wave, and then we got our QRST. The P wave is what part of the heart? P is what part of the heart? It is the atrium. Which means that the QRST is what part of the heart? When the ventricle contracts. So now, if I've got QT prolongation, meaning this is getting longer and longer, and it's getting longer and longer, what can happen to my ventricle if I've got QT prolongation? I can get a dysrhythmia. And that dysrhythmia that we're concerned about is part of ASGRAV, right? It is ventricular fibrillation. In this situation, we're worried about the liver. So this is metabolized by the liver. So, I have a history of SVT, supraventricular tachycardia. I've had it a couple of times. Oh, okay, we are not giving you a macrolide. So again, very important to understand and identify these drugs. And then we'll get into some practice questions here shortly. The next one is tetracyclines. So what's the mnemonic that I come up with photosensitivity? SAT for a photo, right? So what drugs are there? Sulfa drugs, which we're going to talk about as well too. Then we've got amiodarone, which we talk about in EKGs. And now we've got tetracyclines. SAT for a photo, which means that one of the biggest side effects that we're concerned about is photosensitivity. So tetracycline, doxycycline, minocycline are going to be used in this situation. Most commonly, you'll see it in acne. In acne, we see a lot of doxycycline being prescribed. So now you're talking about maybe anybody from peds patient to an adult patient that's developed acne. And now they've got this prescription for doxycycline. Well, depending on their age, we've got to be concerned about pregnancy because it is a teratogen. Then we've got to be worried about photosensitivity. Some other ones that the boards like that aren't necessarily something that's commonly seen is teeth discoloration, but they like it. So now we're talking about pregnancy, photosensitivity. So we educate them on what? Wearing long sleeve clothes, wearing a hat, not going out in the sun, avoiding the beach. We're worried about pregnancy. So what type of a question did I just come up with? I'm educating them. It's a select all that apply, 100%. That's exactly how I would ask it. And if I say those words, chances are you're probably going to see it like that. So I'm going to educate them on photosensitivity, GI disturbances, teeth discoloration, pregnancy. Those are the ones that I'm going to look at the most. And that's the way I'm going to ask it. Or it's going to be a straight up freebie question. Patient, let's just say a 16-year-old patient. Oh, here's 2 questions. Okay. I'm making these up off the top of my head. Here's 2 questions that I would ask with tetracyclines. So I'd write these down. A 16-year-old female patient comes in prescribed with acne vulgaris. Which of the following drugs would be most appropriate, for the acne? Straight up freebie question. And I'm probably going to put doxycycline in there. I'll probably throw a azithromycin in there. I'll probably put a penicillin. I'll put all these antibiotics in there. And you're going to have to say it's a tetracycline that I'm going to use. That same patient, 16-year-old female patient, comes in and they were diagnosed with acne vulgaris. And now we're saying, which of the following is the most appropriate action by the nurse? Well, what if I asked them when their last cycle was, when getting a UPT, a urine pregnancy test? Yeah, are they sexually active? If I put those into your answer choices, I put it there for a reason. Not necessarily always the right one, but you better look at it a little bit closer. Why did I put that in your answer choices? So again, 2 questions that I would ask just like that. And I know they're not in the practice questions, so I wanted to bring those up, but that's exactly how I would ask it. It is a teratogen. It is a teratogen. All right. Now, the next ones are fluoroquinolones. And you'll see these now prescribed a lot. They are commonly prescribed, all these. That's why I'm going in order. Ciprofloxacin, levofloxacin. I apologize, I had to squeeze them in there. And moxifloxacin, right? So Levaquin, Cipro. These are Avalox. These are the brand names, but again, stick to the generics, but they all end in floxacin. They're really good for UTIs, respiratory infections, and skin infections. Those are kind of the ones that I like that are going to be tested the most. Because when a patient comes in with a UTI, how many people have seen ciprofloxacin being prescribed? A lot. Is it the first line, though? It's not the first line. That's where I'm going to get you. There's 2 things I'm going to test you on. Ciprofloxacin, and then what am I going to throw in there, and we'll talk about this drug in a little bit, is trimethoprim sulfamethoxazole, TMP-SMX. So when I put that in there, I'm going to put both in there. And the first line for UTI is actually the trimethoprim sulfamethoxazole, which is, again, Bactrim as the brand name. But it's great for UTIs. The problem with this medication is that we can develop a tendon rupture. And what tendon are we concerned about that is debilitating if it ruptures? The Achilles. The Achilles. Think about any sports player that has had an Achilles tendon rupture and they're out for 8, 9, 10, 11 months. They're season ending. So yeah, sometimes they're that debilitating that they don't even recover back from it to their full ability. So again, that's the big one that I want you to see, along with the QT prolongation. Those are the big ones. Moving on. The next one is aminoglycosides. Aminoglycosides. This is your gentamicin, tobramycin, and amikacin. But again, aside from the tobramycin, the mycin is spelled differently. It's MICIN for gentamicin, and amikacin is just ACIN. So again, with this one, severe infections, when do we use it? Which one do we use first? It depends. Again, do we have allergic reactions? Do we have any type of sensitivity? Do we have any type of renal impairment like we do here that we're concerned about? So we're worried about things like ototoxicity and nephrotoxicity. Ototoxicity and nephrotoxicity. I'm highlighting the most important parts. I know there's more in here, but I'm highlighting the things that I'm going to pick out for the boards, things that I would ask you in a practice question. So we're looking at their renal impairment. We're looking at their renal function. The next one is sulfonamides. So sulfamethoxazole, trimethoprim, sulfamethoxazole, so TMP, SMX. This is Bactrim. This is your first line for UTIs. This is your first line for UTIs. Now, the thing about sulfa drugs, a couple of things that we need to know. Again, sat for a photo. So photosensitivity, big time. But with sulfa drugs, now this is an antibiotic that's a sulfa base. We have other drugs that are sulfa based too. Think about loop diuretics. Think about thiazides, right? Those are sulfa drugs. Think about sulfasalazine. We talk about that in GI when we talk about inflammatory bowel disease. So there are other drugs that have a sulfa base to it that are in different aspects of medicine. This one is good for UTIs, but it's still a sulfa base. So we must ask them if they're allergic to sulfa drugs. And we must look out for SJS. Anybody know what SJS stands for? Steven Johnson syndrome. All sulfa drugs can cause Stevens-Johnson's. What is Stevens-Johnson's and why is it so dangerous? Why are we so concerned about it? Like your body is going through a fire. Your skin is sloughing off, which means you're losing fluid, which means you're going to become septic, which means that we're concerned about your skin. We're concerned about this allergic reaction. We're going to educate. If you see anything happening with your skin, stop the drug immediately. Stop the offending agent. It's one of those repetitive things that I say. Stop the offending agent. So again, we're looking at liver disease. And then again, we're worried about pregnancy here as well too. So I've said that there are drugs that we're concerned about with pregnancy. The mnemonic is Tarado. If you're on any social media, or if you have the quick tip book, if you look in your notes, those that are my students, it's in there. So it's going to be listed in there as well too. So look for identifying those drugs. The next one is actually a great drug to test on. and it's vancomycin. And we do IV vancomycin for MRSA, which is what? Methicillin-resistant Staph aureus. But the thing about IV vancomycin, I'm just talking IV for MRSA, is that it can cause this transcutaneous flushing. Transcutaneous, so all throughout my skin, I'm flushing. And I look like it's called red man syndrome because I turn completely red. It's that transcutaneous flushing. Is this anaphylaxis? No, we're not freaking out about it. Good. We're not freaking out about it at all. In this situation, we're going to do what? Slow down the infusion. Slow down the infusion rate. Same thing with ototoxicity. If this patient starts to complain of ringing of the ear with vancomycin, if they start to complain of a fullness, then you're going to slow down the infusion. Slow down the infusion. This drug is metabolized by the kidney, so we are very concerned about their BU and creatinine again. Know the drugs, antibiotics-wise, that are metabolized by the liver, that are metabolized by the kidney. In general, if it's a high-yield drug, you should know which ones are metabolized by the liver, which are metabolized by the kidney. Think about NSAIDs, kidney, acetaminophen, liver. Why do we alternate those two in pediatric patients? Because they're developing organs. Why do you think we say give them NSAIDs first dose and give them acetaminophen the next dose and alternate? We alternate because of the fact that they've got developing organs. Don't bombard one developing organ. Now we move on to oral vancomycin. Oral vancomycin. Now, if we've developed Clostridium difficile or C. diff, and we are unable to attack it by other drugs, we can resort to oral vancomycin. Oral vancomycin is a great drug for C. diff. So those are the main takeaways for vanco. And the last one is the big guns, okay? You will rarely see these ones, but if somebody's on them, just know that we pulled out the big guns. This is like setting off an atomic bomb in your body of medication. So imipenem, meropenem, these are carbapenems. And these are the ones that you'll see. Typically, you're going to see these in the hospital. So you've got multi-drug resistant infections. Look at what I put. They're resistant to multiple drugs. That's why they're called the big guns. So you'll see them in places like the ICU because they're being exposed to so many different things. For instance, we've got the old big gun used to be Levaquin or levofloxacin, sorry. Same thing, but I'm going back to generic. Levofloxacin. But then we kept prescribing. And guess what? We started getting bacteria that was resistant to it. So now the big gun that we had was no longer good. That's why we're trying to avoid. That's why I teach you, try to figure out, is this really a bacterial infection or is this a viral infection? And those that are my students know how to differentiate that by looking at labs. We don't want to over-medicate or build up resistance. So these are the big guns. But we're worried about seizures and superinfection. And again, penicillin allergy in this one as well, too. So now we get into some practice questions.